Welcome back, guys. Today I'm going to talk to you about lumps and what happens when someone comes into the practice and brings their pet in with a lump that they've just noticed and they're really worried about it. Before I get going, I'm just going to let you know I do have Carlos here helping me out. Carlos, oh, there you go, say hello. Just in case he kicks over the camera or anything like that. So it's not my fault, it's his fault. So someone comes in or you've noticed a lump on your dog, you're really worried about it and you're bringing it into the vet clinic, and what is the process and what do we do to find out what's going on, and if we need to treat it, how we need to treat it, and what the process is. So the first thing that we're going to do is we are going to take a few things into consideration. So we always look at what's called the signalment of your pet. So we look at the age, we look at have a look at, what breed is your dog, also the position and location of the lump. So those things can give us some really good and important tips and pointers as to whether a lump may or may not be cancerous, or if it is it going to be a benign cancer or malignant cancer? As an example, if I have a desexed male dog come in with a lump near the anus, I'm generally always pretty worried about that. Or if I have an entire female dog come in with mammary lumps, that will really concern me as well. So those kind of things do help to give us some idea about the urgency of getting samples and further testing for lumps. The next thing that we tend to look at is the size of the lump and the general appearance of it. Does it look inflamed? Is it hot? Is it painful? Is there hair loss around that lump? Is it sitting in a glandular structure, so where we should have lymph nodes? And is it painful? If you touch it, is it sore, and is it hot? Is it red? One other thing that we look at, has it come up really quickly? Did it come up really quickly? Has the dog been licking at it? Is it bothered by it? That will give us some hints into what's happening with that lump as well. There are certain lumps that we can look at straight away and go, yep, okay, this looks like a wart. I know my own dog, Ali, who's now a 14-year-old schnoodle, she has curly hair and she is tending to get a lot of little warty lumps coming up as she gets older. And that's a common thing that we do see. I do always check all of them out because she has also had one lump that came up that was a little bit less typical than the others, which I did a sample on it and it was actually an atypical melanoma. So don't assume that because a dog has one type of lump that any other lumps that come up are going to be exactly the same. So the next step is, so we've had a look at all these factors. We've looked at the type of dog, the age, the sex, the neuter, whether they're neutered. We've had a look at location, the appearance of the lumps, etc. The next step that we do sometimes, and if that all that indicates it, is to get a sample of that lump. We really try and be what we call non-invasive to start with. So we want to do a procedure that's not going to require an anaesthetic. And we also want to be able to get as much information from that lump as possible from an initial, quite simple test. So that test is what we call a fine needle aspirate. No, pretty much it is as it explains. We get a needle, we pop it into the lump, we agitate within the lump and try and get as representative a sample of the cells from that lump as possible. Pop it onto a microscope, stain it up and have a look at the cells. The things that we are looking at when we look at the microscope slide to determine what's going on, we look for factors that show us if the lump is it inflammation? Is there infection? So we look at certain types of white cells that might come up in that environment, so cells called neutrophils, or do we see bacteria? Are we getting a pussy smell? Does it stink when you get some the tissue out? So those things also give us an indication. The other thing that we look at is if we're not seeing a lot of inflammation or we're not seeing bacteria, we start to look at characteristics of malignancy or characteristics of cancer cells. Those characteristics we then break up into certain types. So how do they look? Are they round type cells? Are they uneven, what we call spindle cells? Do those cells, if they're round, do they have a lot of granules in them that can be an indication of a mast cell? Do they, do I have these really big, ugly looking macrophages, which are actually probably okay to see because they're mostly an indication of an infection. Are those cells clumped together in groups, or are they spread out all over the place? So there's a whole lot of different tells and telltale signs that we look for. Some of the other things, once we look deeper into the actual cells, so we decide that we've got a cancer, we have a look at the nuclei of the cell, the proportion of the nuclei to the cytoplasm. The nuclei, the center of the cells, do they have darker areas within them that indicate that we're having abnormal splitting and mitotic figures, going through those cells? So there's a whole lot of different characteristics and things that we look for in a fine needle aspirate. Once we've got the fine needle aspirate, that may tell us, yep, we've got characteristics that are cancerous, or we have characteristics that are not cancerous. Sometimes we just don't get a good sample doing that. The reasons might be that the mass, it's too full of blood. So all you're getting is a lot of blood coming through, or red blood cells, and you're not really picking up the cancerous cells or non-cancerous cells. And you just don't know if you're not able to get a good representation of the sample. So sometimes we have some nasty cancers called hemangiosarcomas that can sit within the skin, and sometimes we don't get cancerous cells. Sorry, Carlos is jumping up, that from those samples. The other reasons that we might not get a good sample is if you've got a really firm tumour, and by popping a needle in, we just don't get a good sample from it because it's too hard and it's not aspirating effectively. Another reason that we might not get a good sample is if the cells are really, really fragile. Sometimes some cancer cells, they just break apart as soon as we try and get that sample. And unless you can have a look at a cell in its entirety, so by that I mean the nucleus and the cytoplasm all together, we can't tell what the cell is if I don't have the whole cell in that kind of, and as good a representation as possible. Okay, so we have done our fine needle aspirate. We have either something that's come back as a cancer, or something that hasn't come back as a cancer, or something that we can't get a diagnosis from. Often the next step from there is to do what's called a biopsy. So a biopsy and fine needle aspirate are quite different, because a biopsy is when you need a chunk of tissue. So, and what we're looking for that's different in that chunk of tissue is we are looking to have a look to see how those cells sit next to each other and within the tissues that they live in. How are they within the normal tissue that's there, and how are they dividing next to each other? So you do tend to get a lot more information from a biopsy sample than a fine needle aspirate sample, but it is more invasive and will generally need an anaesthetic to get a sample, because you're cutting out a chunk of tissue, which can be painful. Plus, it's very rare to get a pet that will want to sit still for you while you cut a chunk of tissue out for a biopsy. Very, very occasionally we can do some under local anaesthetic, and that can be quite helpful for some pets too. Biopsy sample comes back, and the other thing from the biopsy and also having those fine needle aspirates, if we do have something that has shown characteristics of malignancy from the fine needle aspirate, that can often tell us in some circumstances how wide margins we need to take from that lump. As an example, mast cell tumours are quite nasty, and we need to get big wide margins from them generally for pets. And you can imagine if you have a lump on the foot or leg area, there's not a lot of skin to close down a wound. So if I need to take out a lump that might be about 1 centimetre, and if I'm removing that 1 centimetre lump, but I need to go 1.5 centimetres this way, 1.5 centimetres that way, 1.5 centimetres up and around and deep, it doesn't leave you with a lot of tissue to close down your wound. And sometimes you need to do things like take toes and so forth to get effective closure on wounds. But if we know what we're dealing with, and we know that it's less likely to be a really malignant, nasty type tumour, then we can adjust the margins and our surgical plan to deal with what we are looking for. But without taking one step at a time, we don't have all the pieces of the jigsaw to treat your pet most effectively. Sometimes as well, if we do see a lump that does turn out to be quite nasty and malignant looking, we will want to do chest x-rays and look for potential spread of any cancer before we put them through what could potentially be a big and painful surgery as well. We want to make sure that whatever treatment we do is really aiming for a benefit, and that we are going to improve the quality and quantity of your pet's life. That should be the ultimate aim from doing any surgery, not just to get to an endpoint. It is really, you do something because there is the chance of an outcome that's going to be really positive for your pet. So I hope you've really enjoyed finding out a little bit more about the process of what happens when we have a pet that comes in with a lump or a bump, and how we go about number one, diagnosing, but also working out our treatment plans and protocols.